Hello, this is Wendy Briggs bringing you Monday's Missing Piece. Monday's Missing Piece is a new resource that we are striving to offer all of our members. It's going to be a 3 to 5 minute training. It may come in the version of a recorded webinar like we're doing today, or it may be an actual video blog. It will be supplied to you and your team from one of our amazing mentors here at the Team Training Institute. So our vision with this is that it's condensed content that will be very easy for you to roll into your morning huddles or team meetings. So we strive to keep it brief and to the point so that you can more easily utilize this information. Today, our topic will be dealing with the ACA, or the Obamacare or Affordable Care Act. And some of you might be wondering, what does this really mean for your practice? You know, we don't even bill medical insurance. We don't accept Medicaid, so it doesn't affect us. And I thought that was true as well. I didn't think we'd have to deal with that very much in dentistry. But what we are hearing from some practices out there is they are having patients say, I have 100% coverage for my kids through our medical plan now because we have Obamacare or because we've got coverage through that exchange. So for those patients that are feeling they have 100% coverage for their dental plan, obviously we're going to need to know what we're dealing with. We've even had some patients say, I'm probably going to drop my dental coverage, or some patients who have dropped their previous dental coverage or dropped their children from their dental plan because their understanding is that they have 100% coverage through the medical. So let's talk this through for a minute, because this feeling that people may have may not be true. So if you have a patient that says, I'm going to drop my dental coverage, I would encourage you to respond with a not so fast. Let's check out what your benefits really are. Because what we're finding with a lot of the people who feel they have the coverage is that they have visited these insurance marketplace exchanges. So I want to spend just a moment and review with you some key facts of what the ACA really means for us right now. These insurance marketplace exchanges have been set up, and all of the challenges and problems with those exchanges are another story altogether. They're not functioning very smoothly at this time. But inside the exchange, insurance must offer coverage for pedodontic patients unless there's a standalone dental policy inside the exchange. The confusing thing is, the patient doesn't have to buy it. There is no penalty for them if they choose not to buy the dental coverage inside the exchange. Now, if they were to purchase insurance outside the exchange, that's another matter. Now, there is no mandate for dental coverage for adults at this time in the Affordable Care Act. So this only applies to children. Okay. Now, again, if health insurance is purchased outside the exchange, they do have to buy the dental coverage. So a plan purchased outside the exchange must include dental benefits for children, even for people who don't have children. Okay, so it gets really confusing for the patient and for really the insurance companies and us as providers. It's very confusing. Patient perception is often that prevention is covered at 100% and restorative at 80%, but this is not always the case. We've got to take the time, and it's going to be very time intensive here initially to call and verify these benefits. Even though the coverage is mandated, the actual benefits do vary from state to state. So what does this really mean for us? If their dental coverage is included inside their medical plan, watch out for the deductibles. This is another thing that's very misleading, and people are very confused about this. There was an example shared with us this week of a plan that was purchased through Group Health. It's an embedded dental plan through United Concordia in their Group Health plan. But when benefits were verified, it was determined that the deductible was $4,000. $4,000 per child. So when these dental plans are embedded in the medical plans, the medical deductible applies before any dental coverage is paid. So there's no dental benefits paid at all until that $4,000 deductible is met, not even preventive. So really what we're dealing with is a tremendous headache. I don't know very many children that are going to utilize a $4,000 deductible on their dental care. People really need to know what they're dealing with. And I will tell you this as well. A lot of these plans may have an orthodontic benefit, but it's only for treatment that is deemed medically necessary. So it's very limiting. We need to make sure that if a patient has coverage through their ACA or through their medical plan, we've got to call and verify and make sure the details are key. And here's another thing that's really confusing is that sometimes you call and verify benefits one day and you're told one thing, and you call and verify with a different person the very next day and you're told something completely different. So make sure that you know what you're dealing with, because obviously if it's determined this patient does not have dental coverage, you may be the one ending up holding on to this bill and having to go after the patient, which is going to be a tremendous challenge. So if you're not on the provider list, another warning that the benefits will be less than expected. So make sure that you really understand what you're dealing with. Make sure the patient knows the details, but we can't expect the patient to know all of their details. But what we have to be careful to make sure is that the patient doesn't expect it all to be covered because now they have this Obamacare coverage. So with that said, short and sweet, that's today's missing piece, Monday's missing piece for you and your practice from the Team Training Institute. Make it a great week.